Good afternoon, everyone. I'm Michelle Steele, Chairman of the Orange County Board of Supervisors. Thank you for joining us today. I stand before you today not just as Orange County Board Chairman, but also as a mother and a grandmother. Earlier this week, we learned some troubling information that a child sexual predator has been released by the state of California into our community. It is our understanding that, as of this moment, Carrie J. Smith has been released from a state mental facility and is currently in Southern California. We don't know for how long he will be here. We were told that he also is not currently registered a sex offender. That is beyond outrageous. Many of you have followed Mr. Smith and the news coverage on this issue. It is documented that Mr. Smith, who is from Orange County, has said he's fantasized about raping young boys. He's claimed to have killed 3 boys and molested hundreds more. For years, while being held at a state facility, Mr. Smith repeatedly testified under oath that if released, he will reoffend. Let me repeat that. Mr. Smith for years testified that if released, he will reoffend. That someone this dangerous would be released into our neighborhoods with little to no explanation and not be required to register as a sex offender is both dangerous and nonsensical. On Tuesday, District Attorney Todd Spitzer and I sent a letter to Governor Newsom urging him to reinstate the sex offender registration requirement and that he be reinstitutionalized immediately. I believe the state should immediately reconsider this decision and hold Mr. Smith. I'm also calling on state regulators to do a thorough evaluation of their process and procedures for these kinds of decisions. If a child predator for years is saying at every hearing he's like to reoffend, that should raise red flags, not the green light to allow him back into the community. I implore the state to take our cause seriously, to take action immediately to help protect our families. Our families, our community deserve immediate answers and action. Do not contact or confront Mr. Smith if you see him. A bit of a positive news, the Board of Supervisors opened a large-scale drive-through testing site at Anaheim Convention Center yesterday. 360 clinics will be conducting no out-of-pocket cost testing. The testing site's initial target is to conduct 600 to 800 tests a day, 5 days a week, while aiming to reach 1,200 a day in the next 2 weeks. There are more sites that will be opened in the near future. This was made possible by the City of Anaheim under the leadership of Mayor Harry Sudeau, along with the 360 clinic. I want to thank Vice Chairman Doe and Supervisor Chafee for spearheading the testing kit ad hoc committee and all their hard work in ensuring that Orange County has the resources and capability to provide testing for the residents of Orange County. And we couldn't have done this without the leadership of County Executive Officer Frank Kim and Dr. Clayton Chow, the Director of the Orange County Healthcare Agency and our Acting County Health Officer. Additionally, last week I announced that the healthcare agency would be adding serology tests as well as raw data to our COVID-19 website that is now available for the public to see. This board is dedicated to transparency and clarify and will continue to work with the healthcare agency and health providers in Orange County to continue providing up-to-date and accurate information during this crisis. Since our numbers are growing, I ask the residents and visitors of Orange County to please wear a face covering when you are in public place and unable to properly social distance, as well as following hygiene and social distancing guidance. This is of the utmost important to stop the spread of the virus. We must also remember that we must protect public health while allowing people to go to work safely and responsibly so they can pay their bills and feed their families. And with that, I will hand it off to Dr. Chow to discuss today's COVID-19 numbers, and then following that, we'll take any questions that you might have. Thank you for joining us today.
Thank you, Chairwoman Steele. Good afternoon, everyone. My name is Dr. Clayton Chow. I'm the Orange County Healthcare Agency Director and the Acting County Health Officer. To start, I want to talk about our case count today. Today, we are anticipating reporting an additional 873 cases, bringing the total of 27,904 cases. We also will be reporting that we have received 11 deaths, 6 from skilled nursing facility and 5 from non-facility, for the accumulative total of death 466. I'm very excited that the county, together with our partners at the City of Anaheim and 360 Clinic, have officially launched Orange County's first super site for drive-through COVID-19 testing at the Anaheim Convention Center, as the Chairwoman Steele had mentioned earlier today. The site can serve more than 1,000 people a day. Testing is available at no cost for Orange County residents who are symptomatic and cannot get testing through the healthcare provider. The test offered at this site is called a PCR test. The test will show if someone is currently infected with COVID-19 and may be contagious. Testing is also available for the following public health priority groups: healthcare workers and first responders, both symptomatic and asymptomatic, workers in congregating living settings such as skilled nursing facilities, jails or homeless shelter settings, individual with close contact 15 minutes or more within 6 feet to someone who's known or suspected to have COVID-19, and essential workers, those with contact with the public such as grocery store workers, social services providers, and government workers, etc. For more information, please visit ochealthinfo.com/COVID test. Lastly, I want to address the issue around the Orange County Board of Education white paper. The county has issued a press release yesterday. Just wanted to reiterate that it is important to note that Supervisor Wagner and I were invited as a speaker for the panel, but we did not write, edit, or even review the white paper that the Orange County Board of Education brought forward. Both Supervisor Wagner and I encouraged the County Board of Education to remain guided in their plan by the medical professionals. Supervisor Wagner specifically seconded the call of panel member Joel Cocken to hear both sides of the mass issue, and I particularly believe that the Orange County Board of Education should follow the same procedures and guidelines in determining the best way to safely reopen school. With that, I want to thank the efforts the Orange County Department of Education and all of our partners in preparing to bring children back to school safely. It is important to reopen safely when the epidemiological data makes sense. So with that, I thank you for your time. I'm going to ask CEO Mr. Frank Kim to come up.
Thank Good afternoon. I'm Frank Kim with the County Executive Office. Moderator, do we have questions from members of the media?
Moderator?
And as a reminder, ladies and gentlemen, if you'd like to ask a question, please press 1-0 at this time. And our first question will be from the line of Nick Jurda with Voice of OC. Please go ahead.
Hi, everyone. Thank you for taking questions again. I had two sets of questions, one on what we know about outbreaks and second on enforcement. On outbreaks, the Orange County Healthcare Agency is saying that the largest number of workplace outbreaks have been at restaurants, which went up significantly after indoor dining reopened and then has dropped since indoor dining closed again earlier this month. I was wondering if there's any more light you can shed on what you're seeing in the data with contact tracing and outbreaks, if there's any behaviors you're seeing out there that are linked to outbreaks, things like large parties or workplaces, some workplaces not implementing safety procedures, et cetera. So any more light you can shed on what you're learning in that data. And then secondly, on enforcement, I'm curious how enforcement is currently working. Are you working with the state strike teams? Has anything been enforced? We're hearing about lots of businesses still operating indoor operations that are supposed to be closed under the latest closure orders. So we're just curious what the enforcement situation is.
Well, thank you for those questions. I'll make a few comments and then I'll ask Dr. Chow to respond to your questions as well. I can share with you that from a county perspective, we absolutely look at any opportunities that may exist where there is a higher risk of infection. And certainly there have been indications that there were cases that occurred through the indoor dining environment. And I think our board took a very good proactive step this past Tuesday by allocating up to $10 million of our CARES Act funding to develop a COVID-safe restaurant program. And I think part of the reasoning for that, obviously, is to ensure that not only are we providing an incentive for businesses to voluntarily comply with the guidelines that are established by the state, that as we ramp up our review and enforcement as well, that there is a balance between encouraging our restaurant operators to abide by all of the criteria, as well as ensuring that where we identify that there are violations of the criteria, that we're working with the state as required to identify situations that need their attention. And with that, I'll ask Dr. Chow to respond.
Hi, Nick. Thank you for that question, Nick. So let me answer the first part of your questions. You are correct, as my staff have, in fact, responded to your request in discussing the infections in businesses such as restaurant. And clearly, since the closure of the restaurant before July 4th, the indoor of restaurant before July 4th, we have seen a decrease in number of contact from the restaurant to ask for help when they have more than one or two employee that was infected. So definitely there are some other business sector that also have contacted us when they have an outbreak in terms of their number of employee. But those business sector are not consumer-facing business sector, so I don't have that concern. What it means is that the infection is happening in the community. People get infected in their daily behavior or activity in the community, and then they bring it back into the workplace. And clearly, we have a huge effort in educating the community what to do when you tested positive, or if you suspect that you might have COVID, or you even exposed to someone with COVID. And I don't know if you know, our county-wide healthcare agency, as well as the CO's office, PIO officer, have created a really nice educational postcard with a QR code that direct people into our website, and we kind of released it yesterday through our drive-through effort pilot program. And what I heard, the comment back is that it was very, very well received. I actually have sent a copy up to the state because the state asked for it. As far as Your second question about enforcement, as I mentioned last week, that I worked very closely with our alcohol beverages control entity, and as far as I know, over this last weekend on Saturday and Sunday, they visited 217 business entity, and there was 0 citation given out. So, thank you.
Next question, please.
Next question will be from Luke Money with the Los Angeles Times. Please go ahead.
Hi, everyone. Thanks for taking the questions, as always. The latest data indicates that on a per capita basis, new coronavirus infections or confirmed infections are now rising at a higher rate in Orange County than in other places in Southern California, including Los Angeles County, which didn't used to be the case. I'm wondering what your reaction to Orange County's numbers are overall, how you think the county is doing, and what factors you think have played a role in the county's rates going up, whether there are any policy decisions that were made, for instance, the mask mandate debate that happened last month that may have contributed to this.
Certainly, and I think I'll ask Dr. Chow to respond to that question, but what I can share with you is that if you look at the state monitoring website, it does provide a 14-day window into the number of cases per 100,000 for all counties in California. And as I reviewed that data, when I looked at the Southern California region, it seemed as though between all of the Southern California large urban counties that included Los Angeles, Riverside, San Bernardino, Orange County, and San Diego, that our cases per 100,000 were very closely in line. Obviously, there are some days where one county is higher than another, but I did not see us as an outlier within the large urban counties in Southern California. Dr. Chow?
Hi, thank you for your questions. And yes, Mr. Kim was correct. And if you actually want the actual number of case rate in Orange County, we're currently at 247. I want to address the issue of positivity rate. And I think that every county have had an effort in getting people tested, and particularly in Orange County, we have been asking our providers as well as our testing place to really make priority for people who are symptomatic. And so it is a number issue, right? It's the matrix that put out. If you are concentrating on testing more people who are symptomatic and people who are most likely would have the virus, then you're going to be able to identify a higher ratio of people who confirm as positive. Again, this is a pandemic. We have infection in our community everywhere, and that's why there's effort in dimming the environment. And the effort, as you saw 2 weeks ago, was to close indoor activity in a variety of sectors. So we are predicting that within 2 to 3 weeks from that day, we would be able to see a lower rate in terms of people who have a higher risk of contracting the virus in the community. So thank you for your question.
Moderator, next question, please.
Next question will be from the line of Jiyoung Park with the Orange County Register. Please go ahead.
Hi. I have a lot of questions, but I just figured I just should ask one. Dr. Chow, you said it's important to reopen schools safely. Obviously, we've been waiting and hearing reports of big districts like Santa Ana Unified and other districts exploring and announcing their intention to go online only. I'm kind of curious about what's your thought to those announcements and your reaction to those.
Thank you so much for your question. I have worked very closely with the the Orange County Department of Education as well as individual districts. As you probably have heard me talk about it before, it should not be a one-size-fits-all because the epidemiological data as is related to youngster under the age of 17 is very different in each county. And so we really need to look at the data per city, and that's why we have been showing that so that the school and the community, including the parents, would make the right decision for their geographical area. You probably have heard that the governor will be issue a set of guidance as is related to school reopening tomorrow at noon. So everybody is anxiously waiting to see what that is, and so that we can continue to have a conversation to make the appropriate choices for each of the schools, for each of the cities. So thanks for that question.
Next question, please.
Next question will be from Paul Anderson with the City News Service. Please go ahead.
Hi, Dr. Chow, I was wondering, have you given any thought to this, or I've talked to some experts who suggested that holding classes outside would probably solve a lot of the problems with transmitting the virus. And is that on the radar of school officials that you've consulted with or talked about? And have you thought about, does that make sense to you? And then also, have you thought about providing that guidance to some local officials? Because all I see most of them offering is either online only or going back to school, or a mix of both.
Right. Okay. Great question, Paul. And some of the school district and even with the Orange County Department of Education, we have talked about that. Holding classes outside makes a lot of sense. And just like in the dimming process now, the state and the governor and our local official do agree to outdoor activity. And so that is actually a very good option. And I suspect that the state would discuss a hybrid model, right? Hybrid not only in person and online, but probably in person outside. Now, as we move to the latter month of the years when the weather changes, that would be an issue that we have to tackle, right? Because when you expose children to the cold, there's other respiratory infections you have to also have to talk about as well. So really good suggestion, though. That conversation has started with the school. Thank you.
And I just wanted to provide a little bit of clarification. I had a few minutes to check on the state monitoring website. Earlier, there was a question from the Los Angeles Times asking about the county's positivity rate, cases per 100,000 compared to other Southern California counties. In reviewing the 5 large urban counties in Southern California, there are 2 counties with higher infection rates per 100,000, and then there are 2 counties that are lower than Orange County. So Orange County is right in the middle in comparison to the 5 large urban counties in Southern California in terms of number of cases per 100,000, as reported on the state monitoring website over the last 14 days. So I just wanted to provide that update. And with that, moderator, next question, please.
Next question will be from John Earl with Surf City Voice. Please go ahead.
Yes, thank you for taking my question. This is for Dr. Chow, please. Dr. Chow, on your first day on the job, I believe that was May 5th, and during the Board of Supervisors public meeting, Supervisor Wagner said that people who were going to the beaches, stores, and restaurants felt safe, and that, and I quote, the medical science is behind them, unquote, and that, again, quote, we can start tailoring our message and our rules with those who are at risk and let the rest of us get about our lives. The emphasis was his. To back up that message, later on, he cited your predecessor's attempt to enforce COVID law at Nomad's Cantina and complained that the county should not be involved in that. citing a previous decision, a policy decision made by the board. Similarly, Michelle Smith, the chairperson of the board, has made similar statements. And Dr. Chow, in your view, as a public health official, is it possible either scientifically or ethically or as a matter of good policy, as part of your official response to COVID-19, to essentially divide the general population into two broad and ostensibly unrelated groups based on age and other so-called pre-existing conditions? Thank you.
Thank you for that question. I want to preface it by saying that, as you know, even now that I'm at this position for a little bit over 2 months, there's a lot more science about COVID-19 that's coming out every day. You have, at least I have seen the changes in CDC and WHO direction as to what to do with the face covering as well. And you've heard me talk about this, right? New information coming out every day. So I don't know if we could go backward and say, well, should we done this or should we done that? Well, we didn't have enough information to make any clinical decision, let alone policy decision. So that would be my personal opinion. But in your suggestion of dividing people up into two separate groups and treat them differently, I don't think we can, because we're a community of everybody together. How do you divide them? How do you divide us up into two groups, right? There's no separations. And that's why the best we could do is encourage people who are at risk. Again, people with multiple health condition, young people with multiple health condition, and our senior citizen over the age of 65 is to stay in-house as much as they can and not go out and expose themselves to the community. And even that, we are creating a situation where grandparents and grandmother, elderly parents have not been able to see their loved one who don't live in the same household for months now. My own mother has not seen her grandchildren for months, right? That has an emotional impact to it, and we all talk about it. And so I think it's going to be very difficult to say that we treat one group one way and treat the other group one way, because we cannot do this, right? Even individuals who are elderly living in the elderly home, the caretaker, the youngster, the one who go out in the community and do whatever they do in the community and bring it back, unfortunately, into the care setting. So thank God everywhere we have a better control of the senior living situation, such as skilled nursing facility. But even at best, they're still at risk because we don't have a society where we split people up into two separate parts. So, but thank you for that question.
Next question, please.
Next will be Amy Taxon with the Associated Press. Please go ahead.
Thank you so much. Yes, I have two questions for Dr. Chow, if I may. The first question is, we understand that the governor's office has already briefed the county health officials about the announcement tomorrow on schools, and that counties on the monitoring list are going to be advised not to reopen in-person learning. Can you confirm this? And if so, what is your position on what the Orange County schools should do? And the second question is, if you could please address any concerns you may have at this time. Well, do you have concerns about the ICU capacity? How far out is Orange County from a scenario where staffing or space might become inadequate?
I'm going to have to, thank you for your question, but I'm going to have to ask you to repeat the second question, but I didn't hear it right. But let me address the first one first. Yes, of course, the State Department of Public Health, usually before an announcement or decision, the State Department of Public Health would call all the health officers together and have a discussion about what might happen the next day. And actually, it was supposed to be today, but it got postponed to tomorrow at noon. And so we have a discussion, but we don't actually know what the final decision will be. So it would be premature for me to say this is what is going to happen, and that's why I've been vague, because I'm anxiously waiting to see what kind of final decision is going to be happening. And yes, I mean, for the county on monitoring list, there will be a set of guidelines timelines for us. And I'm anxiously waiting for tomorrow to see what that is. And then we'll have a conversation with the school districts and with the Department of Education to plan for following the guidance. And please, could you repeat the second question again?
Yeah, sure. Thank you so much. Yeah, I just wanted to know if you could address the county's ICU capacity.
Oh, yes. Thank you. Yes, I remember now.
Space and also staffing. I know this has been an issue raised
Yes.
in Los Angeles County, and we want to know how Orange County is doing in this
Got it.
in this sense. And if you're looking at your trends, are we facing a potential scenario where we have insufficient staff or space?
Got it. Thank you so much. And so the ICU, in terms of the ICU bed, we have capacity, and our number has been fluctuating up and down, but it's stable. And then, well, I shouldn't say stable, and then tomorrow is going to go up, and then you come back at me, right? So the bottom line is we have capacity as it's related to the bed availability. But we always have concern of staffing because, we are 4 or 5 months into this now. The nurses, the hospital personnel really reach fatigue, and as well as people who got sick because of their profession exposed them to the virus. And so, of course, we're very concerned about staffing issue. The healthcare agency has early on a contract with what we call temp nursing and temp professional, and we have several contracts going that readily we will connect the individual hospital that need to have staffing support with those contracts so they can get people in. We've also talked to the state, and the state has what they call a team, ACS team, that readily make available for county should county request. And so far I can tell you there's only one hospital request for that team, but they only needed nursing and not the entire team. The entire team come with doctor, respiratory therapists and nurses, but that hospital only asked for nursing, and as of now it is not an option. So we're negotiating with the state that perhaps the hospital can only should be able to only ask for nursing and not the other professional, because we don't have a shortage of the professional. So I hopefully I answer your question. Thank you.
Next question, please.
Next question will be from Brandon Foe with the Voice of OC. Please go ahead.
Hi, thank you. My question is two-tiered. First off, HCA says it's just under 40% of ICU beds are available right now. So my question would be, how many ICU beds could the county reach if all the hospitals expanded through surge capacity? And secondly, on my end, it's been hard to get doctors to even sit down for interviews because they're so wiped out after their shifts because staffing is so low. What is the county hearing what the situation is like from its people on the ground, who surely must be trying to have these same conversations with hospital staff? And does the county believe the hospitals under surge capacity would be able to maintain the standard 2 patients per nurse ratio for ICUs? Thank you.
Thank you, Brandon, for that question. So I'm looking at my number now. Orange County ICU without surge, we have 1,046, and currently we have 642 occupied. Now this is for all patients, not just COVID patient, and that leaves us with 39% or 404 ICU bed ready. As far as hospital fatigue from physician to staff, my emergency response service area have meeting with all of the hospital 3 times a week, and we have a meeting tomorrow, and I'm getting ready to join that meeting to ask the very question that you asked now, Brandon. So hold on, I might have an answer for you next week. Thank you.
Next question, please.
Next question will be from Hassan Elatar with Voice of OC. Please go ahead.
Hi, thank you for taking my question. My question's on the reopening of schools. I'm curious to learn how is the county helping school districts get the technology they need, such as laptops, Wi-Fi's, or hotspots, iPads, to do virtual learning, and if schools are allowed to continue with hybrid models, how will the county help them get the PPE they need and the hand sanitizer and make sure it's enough?
Thank you for that question. What I can share with you is that in terms of management of school protocols, school resources, that is a responsibility of the state and not a responsibility that is assigned to the county. But that said, I know that the school districts routinely reach out to our healthcare agency to discuss guidance and discuss protocols, et cetera. I'm aware that just this morning, Dr. Chow was on the phone with a local school district, and they had a 1-hour consultation about the plans that our local school district was working on. And I believe, again, tomorrow he's on another call with Department of Education and school districts. So those discussions and consultations happen regularly, many times a week. In terms of PPE and other resources, what I can share with you, again, is that the state has been doing a very good job, and recently we received about 150 pallets of PPE over the last week that came in from the state, and those included masks, gloves, gowns, et cetera. So the county is doing much better in terms of its availability of PPE to share with our partners within the community that might need access to those. And those include hospitals, law enforcement, and might also include schools. So we are a part of that system, but in terms of, as you discussed, making laptops or iPads or Wi-Fi available to them, that is the domain of the state, and we do know that the state has allocated money to our local schools, and those districts are having conversations with state officials. Next question, please.
Next question will be from Paul Anderson with City Sue's Service. Please go ahead.
Frank, given the situation with the positivity rate being rather high, higher than the state threshold, have you given any thought to, I know that there's been some backing off of the, testing everybody because, how that's been causing problems, but maybe having a certain amount of asymptomatic people tested to try to bring down that positivity rate, since if you're only going to focus on people who are obviously sick or symptomatic, your positivity rate's always going to be high.
Well, thank you for that question, Paul. There's no effort on the county to go out and actively recruit asymptomatics to test. That would defeat the purpose of what we're doing. In terms of how the county is operating our sites, from the very beginning, we had prioritized those that were symptomatic and needed testing to quickly resolve and identify their situation so that they can either isolate, take treatment, et cetera, and also not infect others, and to be able to process those tests quickly. From a county perspective, we have taken the appropriate measure to work with our vendors, 360 Clinic. They have their own lab. They have a ready supply of PPE, and they have a supply of testing kits. So we're not expecting for there to be any significant issue. But obviously, as time goes on and we continue to do large-scale testing, and we're averaging almost 7,000 tests a day, that's significantly more than what we were doing, obviously, even 30 days ago. And it's hard to predict where we will be 30 days from today. But our goal has been to test not only those that are symptomatic, but also those that are at high risk, those essential workers, our frontline law enforcement, the 911 operators, those individuals that are working in face-to-face contact with residents on a daily basis, such as our grocery store workers, those employees and our restaurant workers. We want to be able to provide that testing. That is a commitment that we've made. Our board, about a month ago, took action and voted on testing criteria and priority. And at that time, they identified those essential workers as our target audience, and that is the testing program that we've built. Obviously, if we get into situations where we run into a testing supply or capacity shortfall, we may have to re-examine that priority. But what I can share with you today is that we opened our super site in Anaheim. We're working on our second site in another area in Orange County, and our intent is to test essential workers, both symptomatic and asymptomatic. Another question, please.
Next, we'll go to Matthew Leslie with the Fullerton Observer. Please go ahead.
Hello, Mr. Kim, Dr. Chow. I don't suppose Michelle Steele is still available?
Chairwoman Steele is available for questions.
All right. Well, the first one I suppose I would ask of Dr. Chow anyway. It's more about law enforcement. Law enforcement officers don't seem to consistently wear face coverings. Is there a position that the county health agency has on whether or not they should, and is there any influence you have over any of the enforcement agencies, county-controlled or not, over forcing them to do so if they're reticent to do so?
Thank you so much for that question. I guess from a healthcare agency and the communicable disease department, and particularly a health officer perspective, when we give order, it is for all of citizens in Orange County. And of course, we are encouraging all of our citizens to follow the order. As you hear me every time when I get up here or even in front of the Board of Supervisors, keep reminding people that you really need to do the physical distancing. If you're not able to, you need to wear a mask, sanitization, hygiene procedure, and what have you. Mr. Kim and I have a weekly conference call with the mayors. We work together with our business partner, and every time, every call, Mr. Kim, if I'm not mistaken, we, at least one of us or both of us, remind our partner that this is the thing that we ask them to help us to educate the community to follow. So I think we do the best we can, and we want to encourage people to do that. I think earlier you heard me talk about the postcard in advising people what to do when they tested positive or when they are exposed. On the other side of the card is the same message of, you know, wearing masks, physical distancing, and washing your hands, etc. So.
But Dr. Chow, do you ever speak directly with the heads of the law enforcement agencies? And if so, do they or the mayors you speak of push back at all about their officers or personnel wearing protective equipment? Because I've personally observed them not doing so.
Yeah. I don't hear any pushback. In fact, several of my colleagues, sheriff department as well as my mayor that we talk to are very supportive of mask wearing. So I guess I don't know how to answer your question then.
Moderator, next question, please. I believe we have time for one more questions. And just to follow up with what Dr. Chow had said, what I can share with you is that obviously the sheriff has made these statements before, that the rate of infection that we've seen in our jail system when COVID first began, there was a steady rise in new cases. And with the work of the healthcare staff as well as the deputies that have access to N95 masks and all the personal protective equipment, we've seen a dramatic decrease in the number of new infections that are occurring in jail. And I can certainly report to you that within that enclosed environment, that all of our personnel and including sheriff deputies are wearing the appropriate PPE. So they're certainly following the guidance from a healthcare office within those settings. Next question, please.
Next question will be from Jiyoung Park with Orange County Register. Please go ahead.
Hi, I'm glad that I got to get the last question in. That's great. I am curious about the contact tracing, especially for school. That's going to be crucial when school reopens, or if school reopens. And it's been documented that Orange County is short of the contact traces that are mandated by the state at the moment. So when and if the school reopens, is Orange County have enough contact tracers to deal with any cases in schools, in the educational system?
Thank you for that question, Mr. Park. Actually, it is an effort of the school districts as well as the healthcare agency. If you read the guidance from the state for school, school also have responsibility in supporting the tracing of the individual who are exposed or test positive from with the COVID-19. From the healthcare agency perspective, we are working and have been working very closely with the school to prepare for that. In fact, a couple of weeks ago, we got the okay from the state to contract out with a third-party vendor to extend that capability, and we are in a process of very soon engage a third-party vendor to help us to do this. So, and I want to make sure that it is an issue for the entire state, not just Orange County alone. So, thank you, Mr. Park.
Thank you, everyone, for participating. That concludes our press conference for today, and we look forward to meeting with you next week.